Okay, so this week's interactive case study is asked us to talk about carbidopa. And so I made a few slides about combination therapy and how it helps to treat symptoms of Parkinson's disease. So carbidopa and Parkinson's treatment are closely related. They have been for some time. Parkinson's is the depletion of dopamine in the brain. And because of this depletion of dopamine, the Parkinson's patients often shake, have tremors in their extremities, and consistent deficiencies in movement and control of voluntary and involuntary muscles. Carbidopa is a drug that's used in combination with levodopa to treat these symptoms. And this drug regimen can be very effective. It slows down the breakdown of um, the levodopa and it extends the active time in the body for dopamine. So, things to remember: levodopa is an isomer of dihydroxyphenylalanine, and it's actually the metabolic precursor to dopamine. So, it eventually does get converted to dopamine in the basal ganglia of the brain, and that's how it treats the Parkinson's. And lastly, I just want kind of a reminder that this class of drugs are called dopaminergic agents, and there are several different types, but we're talking about carbidopa. So, chemically and molecularly speaking, let's go ahead and look at how the drug works on the molecular level. So, we it was mentioned in the prompt that carbidopa is a hydrazine derivative of the neurotransmitter dopamine. One thing of note is that it does not penetrate the blood-brain barrier, so it doesn't affect the central nervous system. And like I mentioned, it's used in conjunction with other drugs. Um, One of the derivatives is also known as 3,3,4 dihydroxyphenylpropanoic acid, and that's the S configuration where the hydrogens alpha to the carboxyl group are substituted by hydroxyl and methyl groups. And then we'll talk about the L configuration as the presentation moves along. So more molecular and chemical talk. It's a dopa decarboxylase inhibitor, and so it prevents the levodopa quickly turning to dopamine, and that, along with the carbidopa, is what's been found to work well. Combination therapy that was approved back in 1992 by the FDA, and then I'll move myself if I can. I can't. Oh, yes, I can. Sorry. So I just put a couple of images. There's the wireframe one on the right and the ball and stick, and I've rotated them, but I have some better images coming up. Okay, so this is kind of oh, sorry. Okay, there we go. I don't know why. No. Okay, I'm having some technical difficulties here. Anyway, so this image is one of the ones like where you can see the levodopa bound, and what's important is it's a lipid soluble drug. So as I mentioned, once it does pass through the blood-brain barrier, then it helps with the carbidopa and it increases the dopamine and improves function that's deteriorated. And there is also some research to suggest more recently that the carbidopa interacts with lymphocytes in our blood, and this works through the tyrosine hydroxylase and decarboxylase pathway. Okay, so I really like this image just because it's so simple. And so the figure. This is noted in the works cited, but you can see the dopamine synthesis and the brain activity in the neurons. And it's either used, broken down, or transformed into noradrenaline. And so, anyway, this is kind of one of the final images that I wanted to leave you with, so you could get a kind of a big picture about how dopamine synthesis works and how this Parkinson drug, its mechanism of action and how it facilitates that. And I think that's it.